there, this is Dr. Angela Graper with Family Focused Chiropractic, and today I just want to discuss foam rolling in pregnancy. Foam rolling is kind of confusing in an outside pregnancy anyway, but we're going to go over some specific muscle groups that can feel really good with some foam rolling, especially with pregnancy and the increased load that we experience. So we are going to be chatting about the glutes and the back side of the pelvis because these guys take on a lot more weight because of the shifting weight here. And so we have to have a counterbalance, right? The glutes have to do that. So we're going to be talking about that. If you've ever been pregnant or not and experienced hip pain where it's achy, it's hard to lie on your side, particularly sleeping at night, we're going to talk about the TFL and how that wraps around the side of the pelvis here and into the hip. And then last but not least, we're going to talk about some of the front muscles. Obviously there's a baby belly here, but we can still work the muscles down here if you're having any tenderness or whatnot. So let's begin with the back side and how we're going to foam roll. So you're going to take your foam roller and you're going to be at about a 45-degree angle this way. And this one feels pretty good where you can roll back and forth. And once you find a tender spot, you're just going to stay there and roll back and forth. And then the next one is the TFL muscle. That's the one that if you ever experience hip achiness, again, in or outside pregnancy, this one's really good. I usually don't foam roll this one. I usually find a tender spot and just lie there and try to relax the muscle over the foam roller because it can be really intense. So now we're going to go from about 45-degree angle this way, working out the glutes, the piriformis, all the backside muscles. And now we're going to go into that TFL. So now we're at about a 45-degree angle this way. And again, once you find it, just try to breathe into it because it can be kind of tender. And then last but not least, if you're dealing with any front pain, or sometimes too, if you're dealing with the backside of pain, it's the muscles that are in the front that are tight that are causing the problems. And so you can kind of work this either way to see what feels best. But you're going to lay down underneath the belly, but on top of the pubic bone. And again, you're going to find that tender spot. So you might be in the quad. You shift it a little bit. You can get into that psoas too. This is another one that it might not feel as good to roll over. It might be a little too intense. And so you might just want to find that spot and try to breathe into it and relax and let those muscles go. So again, foam rolling is great for pregnancy, particularly with the increase in relaxin. It makes your joints pliable, which means good for birthing a baby, not so good for holding adjustments. So in between your chiropractic care, your massage therapy, acupuncture, any kind of body work that you're getting to make yourself feel the best in pregnancy, foam rolling is a great option so that you can keep this all nice and aligned so that baby is nice and comfy. And if baby's comfy, mama's usually more comfy. Thanks for tuning in.